Good morning. I'm going to talk about oncology. Neoplasm. A neoplasm is an abnormal new growth of tissue. Malignant neoplasm cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth in the bowel. You have a small tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable. Can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there are other causes such as inflammation or fluid accumulation. Patient said, I have a lump in my left breast. Doctor said, there was a firm palpable mass in the liver. Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade local tissue and may spread to distant part of the body. Metastases. Neoplasm, which are the result of metastases, are called secondaries, as opposed to the original tumor, which is the primary. We have the result of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage, and there is no sign of a spread. So if we remove it, there is very chance of a complete cure. Now, to invade verb is to enter and spread throughout a part of the body, and this process is invasion known. If a tumor is described as invasive, it has the ability to spread. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a space occupying lesion in the brain causes raised intracranial pressure, and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct the lumen and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. A 33-year-old man presented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kilos in weight. He was also complaining of night sweats. He had no significant past medical history. Treatments of tumor. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by therapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. That's it. Now I'm going to read the exercise. Complete the table with words from A, B, and C opposite. Verb: cure, exercise, grow, invade, obstruct, palliative, feel, spread, and swell. Noun: cure, excision, growth, obstruction, palliation, palpitation, spread, and swelling. Adjective: curative, exercised, growing, invasive, obstructive, palliative, palpable, spreading, swelling or swelling. The notes below are about the patient, described in the opposite. Use them to put the sentence 1 to 9 in the correct order to make the next paragraph of the case report. The number 1 is, on examination, his temperature was 37.8 Celsius. The number 6. Number 2 is, there was a smooth, firm 3 plus 4 centimeter mass in the right supraclavicular fossa. This is now number 3. The next one is, there were enlarged lymph nodes in both axial and lingual areas. This is number 7. The next one is, his mouth and throat were normal. The number 2. The next one is, his pulse rate was 100 per minute regular and blood pressure 112 per 66. This is the number 8. The next one is, his cardiovascular and respiratory system were normal. This is the number 4. The next one is, on abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. This is the number 5. And then the last one is, examination of the central nervous system was normal, the number 1. Complete the sentence and look at A, B, and C opposite to help you. Distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called cancer. Tumors which do not invade or metastasis are begin. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. That's it. Ahora voy a leer los ejercicios en español. Completa la tabla con palabras de A, B y C opuestos. El verbo curar, extirpar, crecer, obstruir, paliar, sentir o palpar, diseminarse e hincharse. Sustantivo, cura, extirpación, crecimiento, obstrucción, paliación, palpación, diseminación e hinchazón. Adjetivo, curativo, extirpado, en crecimiento, obstruido, paliativo, palpable, diseminado e hinchado. Ordena las oraciones del 1 al 8 con el reporte del caso. La primera es, en el examen su temperatura era de 37.8 grados Celsius. Había una masa firme de 3 por 4 centímetros en la fosa supraclavicular derecha. Había ganglios linfáticos agrandados en ambas regiones axilares e inguinales. Su boca y garganta estaban normales. Su pulso era de 100 latidos por minuto regular y su presión arterial era de 112 por 66. Su sistema cardiovascular y respiratorio eran normales. En el examen abdominal había una masa palpable de 3 centímetros por debajo del margen del costal izquierdo. Y el examen del sistema nervioso central fue normal. Completa las oraciones. La diseminación distante de células tumorales se conoce como metástasis. Muchos síntomas del cáncer, como la dificultad para tragar, son causados por obstrucción. Lo opuesto de doloroso es indoloro. Una neoplasia maligna se llama cáncer. Los tumores que no invaden ni mestatizan son benignos. Los tumores secundarios son aquellos que resultan de la diseminación de un tumor primario. Si una cura no es posible, debe de darse el tratamiento paliativo y un nódulo palpable sugiere metástasis.